Breast augmentation is a surgery used to increase the volume of the breasts, but also to improve the shape by increasing upper pole fullness or making the breasts look rounder, firmer, and tighter. The ideal candidate is someone who is near their ideal body weight and is overall healthy. Things to consider when contemplating a breast augmentation surgery are the type of implant. Is it going to be saline or silicone? Implant placement. Is that under the muscle, the pectoralis muscle, or below the pectoralis muscle? Incision placement. This can be in the axillary fold, in the crease beneath the breast, or through the areola. Another consideration is the size of the implant, and I discuss all of these factors with my patients during their consultation. The decision to get saline or silicone implants is a personal decision. In general, I tell my patients silicone implants will look and feel more natural. Saline implants may feel and look a little more artificial. The good thing about saline implants is that if you get a rupture, you know it. If a saline implant ruptures, the water will leak out of the implant, your body absorbs it, and you wake up one day, one side's flat, one side's full. With silicone implants, you don't necessarily know if you have a rupture because the silicone isn't immediately absorbed by your body. Because of this, the FDA recommends that if you have a silicone implant, you get screening of that implant at 5 years after surgery and every 2 years thereafter. And regardless of your implants, whether they're saline or silicone, I believe that you should change your implants about every 10 to 12 years. And this highlights the fact that breast implants, like most medical devices, aren't meant to be lifelong. You will need to change your implants about every 10 to 12 years. A very common question I get is, what size implants should I get? This is very patient dependent and it depends on many factors. How tall is the patient? How wide is the chest? What volume are you looking for? In general, about 150 to 200 cc's of implant size will increase the breast volume by 1 to 2 cup size. So if a patient is an A and they want to be a C and they're a small to average size patient, this is about a 300 cc implant. Once the implant size or the desired volume gets bigger or the patient gets taller or wider, then the implant volume must increase to equate to 1 cup increase in size. Recovery from breast augmentation is pretty straightforward. Most patients can return to work in 3 to 5 days, start driving at around 3 to 5 days when they're not taking narcotic pain medicines anymore, and most patients can return to exercise after 6 weeks. Sometimes a breast augmentation is also performed with a breast lift or a mastopexy at the same time. A breast augmentation is used to increase the volume of the breast, while a breast lift is used to raise the nipple areolar complex, raise the breast tissue, and tighten the skin envelope to make the breast higher, tighter, and rounder. How do you know if you need a breast lift? A very common way to evaluate that is to look at the position of the nipple on the chest wall. If the level of the nipple is at or below the level of the crease beneath the breast, most patients will need a lift in combination with a breast augmentation. In the hands of an experienced board-certified plastic surgeon, a breast augmentation is a relatively easy surgery. It's easy for me to perform and it's easy for the patients to undergo and recover from. However, it's very important to keep in mind that implants often require maintenance, monitoring, and revisions over time. So be sure to pick a surgeon that you're comfortable with, that you feel you can grow with, and that is, again, board certified.